Hello, my name is Christina Flood. I am a registered nurse and currently work as a resource nurse at a Trauma One hospital in Indianapolis, Indiana. As a resource nurse, I have the opportunity to work on all of the units of the hospital. This has given me a lot of experience working with people who are suffering from a variety of health issues. One thing I learned quickly is that it doesn't matter if I'm working on the cardiac, oncology, orthopedic, or surgery floors, I will inevitably encounter a patient experiencing a cardiac emergency. The heart is functionally split into two parts, the right and left side. The right side of the heart consists of the right atrium and right ventricle. The left side contains the left atrium and left ventricle. The responsibility of the right side of the heart is to collect deoxygenated blood from the body and send it to the lungs to be oxygenated. The left side of the heart is responsible for gathering the oxygenated blood from the lungs and sending it to the rest of the body. Deoxygenated blood from the body is brought to the right side of the heart by the superior and inferior vena cava. The superior vena cava, located at the top of the right atrium, brings deoxygenated blood from the upper part of the body into the right atrium. The inferior vena cava, positioned at the bottom of the right atrium, brings deoxygenated blood from the lower part of the body to the right atrium. During dystole, when the heart is resting and filling with blood, the blood moves from the right atrium into the right ventricle. During systole, when the heart is contracting, the heart pumps blood forward into the main pulmonary artery. This artery divides into the right and left pulmonary arteries. These arteries carry blood to the lungs to become oxygenated. After the blood is oxygenated, the blood moves into the pulmonary veins. These veins carry the oxygenated blood from the lungs into the left atrium. The blood moves from the left atrium into the left ventricle during dystole, and during systole, when the heart is contracting, the heart squeezes the blood from the left ventricle into the aorta. The aorta then sends the oxygenated blood throughout the rest of the body. Arteries carry oxygenated blood from your heart to other parts of your body. As the heart pumps blood through these arteries, the blood puts pressure on the artery walls. This pressure is called blood pressure. Blood pressure rises and falls throughout the day and is measured using two numbers. The first number is called systolic blood pressure. Systolic blood pressure measures the pressure in your arteries when your heart beats or contracts. I like to remember systolic blood pressure as measuring the squeeze. The second number is the diastolic blood pressure. This pressure measures the amount of pressure in your arteries when the heart is resting between the squeeze. Normal blood pressure is about 120/80. However, it is a rare occurrence when you'll meet someone whose blood pressure measures exactly 120/80. Extreme variations in blood pressure can cause issues. Hopefully, your patients have already sought medical help for these issues. However, most people don't recognize subtle changes, and it isn't until they experience a scary event that they seek medical help. Unfortunately, these events happen in the most inconvenient times, such as in a dental office. Hypotension or low blood pressure is a systolic reading below 90 and a diastolic reading below 60. Low blood pressure might cause no noticeable symptoms, or it could cause dizziness, fainting, sleepiness, palpitations, confusion, blurred vision, nausea, clammy skin, shallow breathing, fatigue, and depression. Causes of low blood pressure range from as simple as dehydration to other more serious medical conditions. Medication to treat hypertension can also lower blood pressure and cause hypotension. I had a patient once who was in the hospital after suffering from a stroke. His blood pressure was super high, so the physicians gave him medicine to lower his blood pressure. I gave the patient his medicine and helped him get out of bed and sit in a chair. After getting him comfortable, I left him to check on my other patients. When I returned to his room, he complained of nausea and dizziness. He also had clammy skin. I quickly checked his blood pressure, and although it wasn't critically low, it was substantially lower than before I had given him the medicine. This quick drop in blood pressure caused my patient to experience many symptoms of hypotension. My patient wanted to get up and go to bed. However, this was concerning. I did not want my patient to faint, so I asked the patient to sit a little longer, and then I asked another nurse to help me get my patient back in bed. Gratefully, my patient recovered quickly and his symptoms went away. Vasovagal syncope or fainting occurs when the part of your nervous system that regulates heart rate and blood pressure malfunction. Vasovagal syncope causes the heart rate to slow and blood vessels in the legs to dilate or widen. This allows blood to pool in the legs, which lowers the blood pressure. The combined drop in blood pressure and slowed heart rate reduces blood flow to the brain, causing a person to faint. Patients often experience warning signs before fainting. These symptoms are pale skin, nausea, feeling warm, cold sweat, blurred or tunnel vision, and a weak pulse. In my experience, patients often feel these symptoms, but they don't communicate them before fainting. There are many situations that can cause a vasovagal episode. Some of these situations include standing up after sitting for a long period of time, bending, lying down, getting overheated, intense physical activity, severe pain, intense coughing, and straining to have a bowel movement. After fainting, patients may have abnormal movements, a slow and weak pulse, and dilated pupils. These patients generally recover in less than a minute, but that minute feels like eternity. I've witnessed many patients having a vasovagal episode. These episodes are scary, even for an experienced nurse. It's important to stay calm and remain with the patient. If possible, elevate the patient's legs. This helps to return the blood flow from the legs back to the heart. When the patient recovers, they're usually confused and scared. It's important to provide reassurance and help calm the patient. Although patients recover quickly, if the patient stands up too soon after fainting, they're at risk for fainting again. Hypertension is one of the most common chronic cardiovascular conditions in the United States. Most people with slightly elevated blood pressures do not have signs or symptoms. People with extreme blood pressure elevations can experience symptoms such as dizziness, headache, heart palpitations, nosebleed, shortness of breath, anger, red face, visual problems, fatigue, insomnia, sore knee, and an elevated body temperature. In my experience, I've noticed that most patients who have slightly elevated blood pressures don't complain of symptoms. Most of them were unaware that their blood pressure was high. However, patients with extreme elevations do have symptoms. The most common complaint I've witnessed are headaches, shortness of breath, and heart palpitations. Most of these patients have a red or flushed face and look and act like they just ran a race. Dental patients may experience temporarily high blood pressures related to a physiologic response to pain or anxiety. This type of elevation isn't an issue for someone whose blood pressure is normally under control. However, over 17% of the American population is undiagnosed as having hypertension. A thorough patient assessment before and during treatment, checking the patient's vital signs before treatment, and reassuring the patient experiencing pain and anxiety will help the patient avoid some of the negative symptoms of hypertension. Angina is chest pain or discomfort that keeps coming back. It happens when your heart isn't getting enough blood and oxygen. Angina occurs when arteries that carry blood to your heart become narrowed and blocked. Anything that causes your heart muscle to need more blood or oxygen supply can result in angina. Persons with hypertension often complain of this condition. The most common symptoms of angina are pressing, squeezing, or crushing pain, usually in the chest under the breastbone, pain in the upper back, arms, or neck, shortness of breath, weakness, fatigue, and feeling faint. Angina chest pain is usually relieved within a few minutes by resting or taking prescribed cardiac medicine such as nitroglycerin. If your patient is experiencing angina, you need to stay with them and talk calmly to them. If the heart pain isn't relieved in a few minutes or by taking nitroglycerin, they need to seek medical attention as soon as possible. Endocarditis is a life-threatening inflammation of the inner lining of your heart's chambers and valves. Endocarditis is usually caused by an infection. Bacteria, fungi, or other germs from another part of your body, such as your mouth, spread through your bloodstream and attach to damaged areas in your heart. These clumps of germs are called vegetations. If not treated quickly, vegetations can destroy the heart valves and cause other heart problems, including heart murmur, heart failure, and stroke. Vegetations can form pockets of pus to develop in the heart, brain, lungs, and other organs. They can cause blood clots to form in the lungs and kidney and cause damage to the spleen. Usually, the immune system destroys harmful bacteria that enter your bloodstream. However, bacteria that live in your mouth, throat, or other parts of your body can cause infective endocarditis. Bacteria, fungi, and other germs can enter your bloodstream through improper dental care. Brushing can cause unhealthy gums to bleed, giving bacteria a chance to enter the bloodstream. Some dental procedures can cut the gums, allowing bacteria to enter the bloodstream. Infective endocarditis can arise from many conditions. Our hospital has seen a huge influx of younger patients being diagnosed with this infection. These individuals were IV drug users. One of the saddest cases I've seen was a girl who was in her early 20s. She was an IV drug user. The doctors assumed this patient had developed infective endocarditis from a dirty needle. Vegetation had settled in her heart valves, and she had pus pockets in her brain. She was a beautiful young lady with dark hair and bright blue eyes. She came from what seemed like a loving family. Her parents, siblings, and cousins were always in the room with her. Unfortunately, medicine wouldn't cure this patient from the effects of the vegetation in her heart and brain. My 20-something-year-old patient couldn't walk or even sit up in bed. She would constantly repeat, "I'm so confused." She had no interest in eating and could not feed herself. Just getting a bath and changing her gown and diaper wore her out. She would sleep for hours afterward. This patient was eventually discharged to a hospice and not expected to live much longer. It was seriously one of the saddest situations I've ever experienced. It is important for patients to notify their physician if they develop any sign or symptoms, especially a fever that won't go away, unexplained fatigue, any type of skin infection, or open cuts or sores that don't heal properly. It's crucial for patients to take care of their teeth and gums and have regular dental checkups. If individuals are at high risk of developing endocarditis, the American Heart Association recommends that they take antibiotics an hour before having any dental work done. Be aware and be prepared. Preparation can make the difference between life and death for patients experiencing a cardiac emergency. It is vital to assess your patient and be aware of their medical history. Patients often experience anxiety at the dental office. I know I do. This anxiety and mental stress can add strain to the heart muscles and contribute to cardiac symptoms. Go over scenarios in your mind. I cannot go into a crowd of people without going over the steps of CPR in my mind. I think it sort of helps me feel more at ease in case a situation arises where I need to use CPR. Being aware of potential issues and how to handle them will help you be prepared and allow you to stay calm if your patient experiences a cardiac emergency. Remember to stay calm. One thing I've learned as being a nurse is a lot of patients experiencing a crisis look to you for strength. And if you're panicking, it's going to cause them to panic more. So remember to stay calm and remember you're not alone. There'll be others in the office that will help you. And it's important to work as a team to provide the best care possible to your patients.